Hi, everyone. Dr. Magaziner here in Cherry Hill, New Jersey at my office. And, we're all in the midst of the COVID crisis, the coronavirus. It's caused by the COVID-19 virus. And I've come up with my 5-point plan that I want to present to you. I've been using this in many of my patients now, and we seem to be having very, very good results. So I'm just going to talk to you about my experience in doing this. I'm not telling you that there's scientific evidence for every single thing I'm saying or there's double-blind placebo-controlled trials. However, I will tell you that I've seen very good results so far with our patients as they're staying well and they're staying healthy. And we're keeping them out of the hospital, which is so crucial right now. It's keeping them out of the hospital so they don't have to go onto a ventilator, get intubated, they run into kidney problems and such. So the first part that I'm going to discuss today is going to be food and nutrition. But overall, my 5-point plan will include food and nutrition. The next day, I'm going to present to you my lifestyle changes, the suggestions I have for lifestyle modifications. My third day is going to discuss the supplements that I'm recommending. The fourth part of my program is going to discuss some of the IV nutrients and IV therapies that we're using in our practice. And the fifth and final for this series will be regenerative therapies. So I hope you'll tune in each day, and I think that we'll all learn a lot from this. So the first part today, I want to talk to you about what I call my superfoods. And actually, before I get to superfoods, I just want to preface by saying, do your best to eat wholesome foods. Stay away as best you can from sweets and sugars because they suppress the immune system. The more sugar in your diet, the more processed foods. They're devoid of nutrients, they're devoid of antioxidants, devoid of fiber. They're devoid of all the things that help us keep our immune system strong. So if we move on to the next direction we want to do is eat lots and lots of vegetables. And over 50% of your intake each day should be healthy vegetables. So I've come up with my 5 superfoods. There are many more than these 5, but these are 5 that I've been using and most of my patients recommending. So first of all, and not necessarily any great order, but try to eat some broccoli and broccoli sprouts. Broccoli sprouts a lot of us don't use enough of, but you can sprinkle them on your food or onto your salad. They look like alfalfa sprouts. You can buy them in the supermarkets. They're very high in what's called sulforaphane, so is broccoli, and they help protect our immune system greatly, not only from viruses, but also from various cancers that we could be prone to. The next food you should think about is eating dark greens. So all kinds of dark green leafy vegetables are good. In particular, think about incorporating kale and spinach into your diet. Also, Brussels sprouts. A lot of people don't like them, but if you flavor and season them in different ways, they can be pretty tasty, and they're super healthy for you. The fourth are mushrooms. Mushrooms have a lot of what's called beta-glucans in there, which actually help to boost the T cells, the natural killer cells, and various arms of the immune system. And fifth, but not really final, but final for today, will be our sweet potatoes. So anything that has a lot of pigment, a lot of color in them is generally very, very healthy. So these are the 5 that I've selected today, but you should be eating many more vegetables than just those 5. Also, various vegetables are part of the Allium family, and these include things like garlic and onions and leeks and shallots. So get used to incorporating these. They have a very good antimicrobial effect. They can help against various viruses, bacteria, funguses as well. So we want to keep our immune system strong with these allium-based foods. The next section are fruit. So we want to eat lots of fruit, but it depends if you have diabetes or if you have other health problems. You may have to be cautious with some of these, although I would tell you that berries are some of the best ones to eat. Why? Because they don't raise the blood sugar very much at all. They have a very low glycemic index. They also are packed with phytonutrients, antioxidants, and so some of the berries to think about would be blueberries, strawberries, raspberries, and even cranberries. You can get them this time of year. Very, very healthy. Kiwi, avocado are good for us too. They're loaded with healthy fats that are so important for our cell membranes, important for the brain, important for the liver and detoxification. So try to eat avocados quite frequently. The next 2, watermelon is good for detoxification, has a good diuretic effect, and also grapes because they are high in resveratrol and pretty high in fiber as well. Once again, these aren't the only 5 fruits, but incorporate some of these. You can incorporate many other fruit into your program as well. What about nuts and seeds? Well, 2 of my favorites are almonds and walnuts. They're very protective for the immune response. They're good for against heart disease, against cancer, good for colon elimination. They're terrific. Try to get the raw almonds if you can. If you can't get them, obviously roasted are second best. Also, try to incorporate more seeds into your dietary intake. So some of the better ones could include hemp, chia, and flax seeds. You can get the ground flax seeds. You can also use pumpkin seeds, sunflower seeds, sesame seeds as well. So incorporate more seeds, sprinkle them into your program, into your diet. Some people put them in a smoothie. I happen to like the chopped almond slivers. I just sprinkle that into a lot of my foods each day. Beans and legumes, very, very healthy for us. We don't seem to eat enough in our diet in America, but anyhow, you should. So lentils are a tremendous superfood, a great source of protein, great source of fiber, and you need the protein, the fiber to protect us against infections. Chickpeas, split peas, you can make split pea soup if you want over the weekend. Navy beans, aduki beans, any kind of beans are very, very healthy, and they're a great source of protein and fiber, and also all these foods have some essential fatty acids in them as well. These do, as well as those seeds I just mentioned a moment ago, which are so important for us. Spices and herbs, we need to incorporate some of these. Some of the countries that use more spices and herbs are much less prone to infections and also less cancers, heart disease. So try to use more turmeric in your dietary intake. Ginger's a great one. Ginger's wonderful against infections, and also some oregano. There are obviously more spices and herbs to use. I'm not a great cook, so I don't use a lot of these myself personally, but these are good for you, and there's many more. So that's it for today. I'm glad you were able to listen. I'm glad you tuned in. I'd like you to tune again tomorrow. I'm going to have part 2, which is going to include lifestyle modifications and what you can do to protect your immune system and keep it strong during this coronavirus crisis that we're all facing today. So stay well, stay inside, socially isolate, wash your hands, do all the good things that we're hearing about. Wear a mask. If you're going out, please wear a mask. It can't hurt. Some people say it won't help, but you know what? It can't hurt you or people around you. If you need to contact us, here's our contact information. We are open. However, we're doing a lot of phone appointments now, so if you want to get seen virtually, by telemedicine, by phone appointments, we are here for you, and we're always here for you. So we'll talk to you soon. Thanks so much, and stay well.